Okay.
Hi, my name is Heather Castor, owner of Bouncefitstudio, along with my son Jack. I wanted to make a video today to talk about pronation, knee pain, maybe ankle pain, hip pain, and back pain. I've been the owner for a few years. I've been doing corrective exercise for over 20 years. I've got into the field because I pronated myself, trickled up my body, had hip surgeries, hip replacement, artificial disc in my spine. I grew up very tall, very fast, very insecure, very hunched over, and with a connective tissue disorder. So my body has fallen apart over time. And I fell into rebounding, fell in love with that, opened up the studio and really realized how much people pronate, how much pain they have, and that maybe rebounding isn't meant for everybody, or is it? So I want to talk about that, about things you can do to prevent it, to get stronger, things to watch out for, and your posture. So you always want to look from the feet up. That's your foundation. So whether you're rebounding, walking, or anything, even people with high arches can still pronate a little bit and still have some issues. So some things to watch for. If you are flat-footed or not, I always like to have my clients wear a nice supportive shoe that helps the foot stay in position if they're unable to do it on their own, such as Birkenstocks. I'm a huge fan of them. I wear them all the time. Ugly or not, it's what I do. But I'm going to take them off for a second and show you what pronation is. What is pronation? It's a fancy term for your foot caving in. When your foot caves in, notice what happens to my knees. They also go in. So someone comes into the studio, someone buys a rebounder, they're out of shape, they hear it's low impact, and they want to start bouncing, but they're pronating. It's not the trampoline per se, it's the fact that their posture is messed up. So they start doing this, they feel fine at first, and after some time, those knees going in, those ankles going in, the hip coming out is causing wear and tear in the joint. The knee is a hinge joint. It is going back and forth. So when you're putting it at an angle and going here, putting undue forces at an angle, over time you will feel pain. Maybe some tears in the cartilage, what have you, crepitus underneath the kneecaps. That pain, maybe you may not feel it there, maybe you might feel it in the hips. Again, when you pronate, the hips have to go here to provide more room for the hip joint so that it has room to move. So then this trickles up to here and you're rounded and then the head has to come up. So I'm exaggerating this so you can kind of see what happens. Pronate, knees go in, hips come out, eyes have to be on the horizon, this kind of tries to fall in place, and you've got poor posture. Then you've got somebody who has poor posture who hasn't exercised much and decides to buy a rebounder because they think it's really low impact and good for them. It is, but I'm here to tell you, you need to fix these imbalances. If you're not able to control your posture, to hold everything in a proper alignment while you're bouncing, you will most likely incur some kind of injury. So I want to make the video. First thing you're going to look at is your ankles. I want you to think that you have baby chickens underneath your arch. You have to roll that ankle up. And the way to find where your neutral is in your foot is to bend over, and these two divots, you have these two little divots here. If you flex the foot, you see these two little muscles, you're going to put your fingers in there, okay? When you're on the ground, when you pronate in, you're going to feel the bone here, the talus bone. You're going to feel that really hard and a big divot here. You're going to rotate that foot up until you feel it nice and even on both sides. So if I'm here, I feel the bone, I'm going to rotate it up. And now those divots have the same amount of give to them, okay? So I'm pronated up, it feels weird, I feel like I'm walking on the edge of my foot, right? If you're one of those people that pronate, your big toe could be shooting off to the side, maybe getting a bunion. And that's because the foot's caving in. The forces of the knee during gait are going midline and not over the toes this way. So first thing you do is externally rotate that foot, open it up, supinate the foot, press the big toe down. Underneath the big toe, all the way under the foot into the back of the calf is a muscle called the hallucis flexus, and it is responsible for pressing the big toe down onto the ground and rotating that ankle up, okay? So once you get that is up, you're gonna notice your knees open up because that's part of the external rotation of the femur, okay? So now the knees are traveling right over that second toe where they need to be, not midline, in the middle, over that big toe or inside of that big toe. So opening up the ankle, rotating the femur and knee, okay? When you do that, okay, now you gotta address the pelvis. The pelvis, and most people that I find, when they rotate it here, they have a big gap, okay? And in order to assess whether you have a big gap or not, which is meaning you have too much of a lordotic curve, anterior pelvic tilt, these muscles in your back are short and tight, and the muscles in your tummy are lengthened and weak. That is for most of the population I see. So you want to learn how to tuck that under, use your abs to pull that under. When you squeeze your glute maximus, that's another external rotator of the femur. So by opening up the ankles, squeezing the butt by tilting the tail under just a little bit is also going to externally rotate, open this up, open up the hip joint, open up the ankle joint, and now put everything into alignment. So when you look at yourself, it should be ear, shoulder, hip, knee, and ankle in a straight line. So another way to test that is to go up against the wall. So this is my wall, okay? You could also do it with a dowel as well. I actually like using a dowel, like putting a belt around, tying it tight to you, so that you can have perfect posture in everything you do, whether you're bending, squatting, twisting, just to get the feeling of what it feels like to be in proper alignment. So here, proper alignment means you can stick a hand width under your low back, okay? Most people can put their whole hand, their whole arm through. And so what we want to do is tilt backwards until your hand gets stuck. So you freeze that there, roll the ankles up, okay? Shoulders are back and down, relaxed in their back pocket. If you're looking at yourself in the mirror, most people I look at, hands are like this. You see the top part of the hand. But the correct way, if everything's incorrect, back and down, your hand should open up, and you should see the first two fingers and the thumb when you're in good alignment and not pronated. So you can also pronate here too. So those are the basics. Now you're thinking, like, how do I control all that? It's a hard thing to do. If you've been in this posture for years, you need to lengthen the muscles that are short and tight, meaning hip flexors. We have the hip flexor muscle. I don't know if you can see it on the screen, but I pulled it up just in case. We have a hip flexor muscle that attaches to every single lumbar vertebra and comes down and hooks into the femur. So essentially, it's from the middle of our body all the way down. When we sit at an office job, sit all day doing something, whether on your, whatever it is, sitting, most of the population nowadays, when you sit, that muscle gets short and tight. So when you stand up, it also pulls the pelvis forward. So maybe you don't pronate at all. Maybe you have high arches, but you still have a big curve in your back, okay? From time of doing this, these muscles are short and tight, tummy's lengthened. So now we need to loosen up the back muscles by tilting that pelvis under, activating the lower abs to pull that under, and make everything in alignment. So there are exercises to do to strengthen the feet. I had very bad pronation growing up, very bad flat feet. You can use orthotics and things like that, that helps, but I really advise to do that when you're walking a long time, your feet are really tired, to help to support them, but also do barefoot exercises. There are lots of different little exercises you can do to strengthen the feet, to strengthen that muscle underneath the arch, okay? And then when you find that alignment and you feel strong, then it's good to rebound. So when I'm rebounding, whether I'm on my Bellicon or a cellar size, they both feel differently. This one has more give, it's softer. This one for me, I feel like I can kind of dig into it with my toes, like fingers, and dig in to make my feet strong. I'm gonna roll it up, squeeze my butt, shoulders are back and down. And I'm just gonna practice that posture. Chin is tucked and I'm all in alignment. So now I'm gonna activate that core by nice tight tummy and just practice health bouncing. The thing that's gonna keep your ankle up is you're gonna feel that big toe pressing hard on the mat. Keeping that arch up, keeping it from caving in. Your tail is tucked just a little bit and you're relaxed, okay? Another huge thing to do with posture is breathing. Whether you're a chest breather, diaphragmatic breather, belly breather, those are huge differences in your posture and how you hold yourself, exchange of gases, and neck pain, and it just goes on and on and on. So I have some videos, or workshop videos. If you go to my website, you can subscribe to those. There are a bunch of rebounding videos in there that we did in our studio, and there are a handful of really good workshops that we talk about breathing, we talk about the TVA, tightening, exercises, how to get that tummy to work right, self-myofascial release and foam rolling and stretching to lengthen the back, to relieve all the tight spots, to strengthen the ones that you need to strengthen. And if you have any questions, be sure to comment, subscribe, text me. I'd love to hear from every one of you. It's my passion to help people get out of pain, to be able to rebound and have fun with it, to be able to get stronger and not induce more injury. So have a wonderful day, and thank you for subscribing.